All right, everyone, welcome to Sexual Assault Myths and Norms, a Public Health Perspective. I am so happy to be here today with you guys. My name is Casandra Jones. I am also known as Miss Cass in the kink and BDSM poly communities in Texas. I started as a infectious disease epidemiologist working in public health organizations. My puppy is wanting attention, sorry. And I got my first master's at Texas A&M in College Station, and really found a love for public health and systems thinking. But I've come to think a little more about the importance of social welfare and mental health and just emotional health in general as well. So I've been focusing my studies now more on mental health going forward and working on another degree in mental health counseling. And so today I'm coming at this more as a public health specialist, as a public health scientist, than necessarily a community member. That's why I'm owning my legal name today. So first, before we get really in depth with things and go off on our topic, we have to lay out some definitions. So we're going to be mostly talking about an umbrella concept today, sexual assault. Sexual assault can include attempted rape, fondling or unwanted sexual touching, forcing a victim to perform sexual acts, whether that's like penetration or oral, and then rape, penetration of the victim's body. So the FBI has a very specific definition they have to use for their crime reports to follow people and follow crime trends. So they define it as penetration, no matter how slight, of the vagina or anus with any body part or object. So that can be a broom handle, that can be fingers, that can be genitalia. Different states have different definitions to meet their own qualifications. There's been some mentions about some legislation that might pass that I really hope doesn't, that would exclude anyone who's had drinking alcohol willingly from it being confirmed a victim of rape, which is BS in my opinion. Then there's, we're gonna talk a little bit about force throughout this, and we just want to keep that in mind, that force isn't necessarily physical pressure. Force can be coercion on multiple levels. This can be psychological, emotional. It can be, someone threatening you in a, like they shake the bed you're on kind of way, but not necessarily hurting you. And that still counts as force. And that can look very different depending on the situation and depending on the people involved. And just a little mention on who are the people that are committing offenses. They're usually people who know the victim. They're not strangers usually. 8 out of 10 perpetrators or 8 out of 10 sexual assaults are committed by someone who knows the victim. And we also know that perpetrators do these kind of things multiple times over and over again, and they do other crimes as well. Okay, let me open our little video here. So we need to define consent as well. To be able to have this conversation, because we're talking about things that aren't always so super clear. You would think they should be, and we're talking more often about enthusiastic consent and things, so it's getting a little more commonplace. But But just to make sure we're all on the same page, I thought we should.
How do you know for sure if someone wants to have sex with you? Well, actually, there's only one way. They need to tell you. You need to have consent. But what does consent really mean? Consent means both parties are really, truly into what's going on. This means that nobody's being guilted or pressured into doing anything. Silence does not equal consent. Some people think it's not rape unless there's fighting, screaming, or someone yelling no. But that's not true. Communication doesn't always happen with words. Body language can say a lot if you pay attention. Are they leaning in or are they pulling away? Do they look happy or do they look uncomfortable? Are they kissing you back or are they just staying kind of still? You have to pay attention to all the signals. This includes body language and words. No one can read minds, so it's always good to talk about it. Asking for consent doesn't have to be awkward. Asking for consent can actually be kind of sexy.
Want to show me your bedroom?
Show me where you want me to touch you.
Do you want to help me take these clothes off?
So, let's break this consent thing way down. 1, everyone's clear about what's about to happen next, and they're happy about it. If you're making out with someone for the first time and you want to go further, check in first.
Can I take your shirt off?
Want to try something different?
2, everyone in the situation has to feel free to be able to say no without being pressured or hassled. It's not cool to pressure people into doing stuff they're obviously uncomfortable with, or make them feel bad for saying no or wanting to stop things. Being pushy or manipulative makes for some pretty bad sex. And obviously, if a person is drunk, high, passed out, or asleep, it's not okay to do sexual stuff with them. They can't consent when wasted or unconscious. So doing this is actually rape. 3, be honest about whether or not you're on birth control, have an STD, or having sex with other people. Wouldn't you want to know that? If you're going to get naked with someone, you have to have trust and honesty. 4, saying yes to sex once doesn't mean you're saying yes to it forever. It may be tough to pause in the middle of some super sweet action, but your partner has the right to stop at any time. And 5, sex is all about connections and pleasure, right? If everyone feels respected, sex will be much better for both of you. We all deserve a safe, pleasurable, and awesome sex life. The more respect you show to the other person, the more they'll trust you enough to relax and enjoy. And the more honest you are about what you want and don't want, the better things will go. It's easy to talk about what consent means, but what does it look like in real life? How are we supposed to know for sure how far someone wants to go or if they want to get intimate at all? Check out our other videos for tips on how to do this consent thing right.
So as that lovely gentleman went over, that consent isn't just a verbal thing sometimes. It can be this body language that is projecting, I'm not comfortable, I don't feel safe. There's, plenty of times when people in the kink communities do negotiate things like consensual non-consent. But those principles that he covered in that video still apply because everyone still feels empowered to say no. They still feel like they're being understood clearly because you cover all those things beforehand. And these things are important to remember. It's the fear to do something is not consent. Someone shouldn't have to be begged or pestered or pleaded with. If that is a problem, then your consent is being violated, most likely. If it is a thing, you definitely want to discuss before you do any sort of activities with someone, and knowing how to advocate for your consent is also important, especially in social situations, whether it's dancing or a bar or a club. When you're in close contact with people, making sure what people know when they do things that are not okay by your standards. So I don't like using the term rape culture per se, but this was a great graphic. I like to use more the term assault culture, because sometimes it's not rising to the definition of rape, but it's still a problem. It's still perpetuated. So for a lot of different culture things, you see this like hierarchy of like power over, or the influence of the action is higher at the top. And at the top, we have these explicit violence things that we understand are wrong, most of us, hopefully anyway. Rape, domestic violence, honor killings, acid attacks. And then there's also the level of like removal of autonomy, sexual coercion, covert condom removal, workplace harassment, emotional abuse. These are the ones that a lot of more of us will agree on. But things like degradation and victimization still feed into this assault culture. And it's not just bad for women, it's bad for men as well. It's bad for gender nonconforming people. It's bad for everyone, because it's this tension and this disrespect for people's rights around you. With degradation, you think of things more like catcalling. Stalking especially is really common. Revenge porn, or sharing conversations of like sexual images with friends that they didn't have the okay to see. And then you have victimization, rape jokes. Victim blaming especially is so pervasive. And maybe a level underneath this could even be objectification of sexual behavior. Whether most of the time, yes, it is women, but you do see it in for men as well in some ads, and that's not okay either. So let's talk about how common this BS is. Unfortunately, there's an American sexually assaulted every 73 seconds during the course of this class. We're going to see at least 40 assaults happen this hour in America. Number of people victimized each year broken down by categories: about 80,000 inmates, 60,000 children. Sexual assault is common in the military too. It's something that isn't talked about as much, but broomsticks have a certain connotation sometimes in that culture, and there's a reason. Sexual assault can happen in many different places, but a lot of the time it's at or near the victim's home, or like within a relative's home. And remember, I mentioned how usually perpetrators know the victim, and they're not necessarily always a partner or something, but they can be a relative or an acquaintance, someone they're relatively familiar with, and that gives them an in to commit the offense. So And quick mention about the in an open public place. And here in America, it's only about 15%. But in areas where you have more public transportation as a norm, it's more common. In Japan, especially, you'll see a lot of upskirt stuff in the subways. You'll see this in some metropolitan areas throughout the world. And we have our own problems here, but because in the US, we rely on cars a lot, you don't see this as much here. And yes, assaults happen on school property as well. So over time, different legislation has been introduced to try to help mitigate this problem. Way back when, 1972 with Title X, just influences what higher academic institutions do in regards to sex discrimination, as well as sexual assault on campuses. And there's been continuous updates to Title X over the years that require different reporting timelines of the university to their population, different funding streams for different programs. There's a lot of different things that fall under Title X now. 1984, the Victims of Crime Act came along, and this provides a lot of money for victims of not just sexual assault, but all sorts of crimes. You will see a lot of community counseling clinics. They can offer free counseling services and sometimes even psychiatric services or other medical services to victims and survivors through grants from this act. 1990, the Clery Act required greater transparency and warnings from colleges and universities. This was kind of added on to Title X in a way. This was just a re-emphasis. And more recently, the legislation has focused a lot on providing funding and requirements for reducing the backlog of DNA tests from rape kits. It started with the Debbie Smith Act in 2004, but there have been other legislations introduced because there just never seems to be enough money to test all the rape kits that are out there. And that's especially disheartening since we know how many of perpetrators commit multiple offenses or commit other crimes. And we could catch a lot of people. So just a little more in-depth mention of the impact of sexual assault on different races and sexes. So women are more likely to experience sexual assault in their lifetime when it comes in the form of rape or attempted or completed rape. But women and men actually experience violence from a partner about the same. That can be stalking, that can be hitting, that can be emotional, verbal abuse, threats of some nature. So women will experience more of the physical violence, but when it comes to more domestic violence, domestic partner violence, that kind of thing, it's a little more even across men and women. Then when you look a little more at gender non-conforming people, whether that's transgender, genderqueer, or gender fluid, 20% of these people in their college years have said they were sexually assaulted, compared to the 18% of non-gender conforming. And Native Americans, American Indians, are much more likely to experience assault at some point in their lives, twice as likely compared to all other races. And also among Indigenous populations, they're more likely to be committed by a stranger than someone who knows them. there's a lot of new interest in fighting the cause in Canada. There's a big push to focus on the murdered and missing Indigenous women along the transcontinental highways across Canada. And it is a great push that is going on right now to try to force some attention on the issue, because they believe that there are people who just go through these areas murder. And because Native American, American Indian, and Indigenous populations don't have as much access to services or hospitals after the fact, or law enforcement, or things of that nature, they are more likely to have negative consequences in the long run as well. So let's look a little at sexual assaults compared to other types of crime. So I mentioned that sexual assault perpetrators, often walk free. You're going to see more often that someone who has sexually assaulted someone, the case is less likely to be reported to the police. Only to about 230 out of every 1,000 sexual assaults are reported to the police. But look at that compared to assault and battery crimes. Look at that compared to robberies. And the less reports lead to arrest, less cases get referred to prosecutors. And again, that's to do with the backlog of rape kits most of the time. Less of them will lead to a felony conviction, and less of them will be incarcerated. And most rapists actually are incarcerated and put in jail for other crimes than necessarily the rape. So let's talk a little bit about the perpetrators more. This was one fact I had not really been aware of before doing my research for this class, that 60% of all sexual violence against inmates in prison is that these acts of sexual violence were perpetrated by institutional staff, not the other inmates necessarily. Like, yes, that's still 40% done by inmates, but we're housing these people and just committing crimes against them, and they can't get away. And as I mentioned before, a lot of sexual assault is committed by someone who knows the victim. 8 out of 10 rapes are committed by someone who knows the victim they assaulted. Here it goes a little, break it down a little further. A lot of the time it is an acquaintance or a partner of some sort. Looking at race of perpetrators, most perpetrators are white. Most assaults are intra-racial, meaning they happen within the bounds of race. But you do see more white perpetrators than ethnic minorities. And while most victims of sexual assaults are under 30 years old at the time of the assault, most perpetrators are over 30 years old when they assault. It's a little, you see this power imbalance between age as well as other things of issues of power. Oh no, my formatting didn't work on this one. So, okay. So we mentioned that people don't want to report a lot of the time, or the charge just doesn't go through in the court system. So these are some of the reasons survivors and victims do report. 28% say it's to protect the household or themselves from further crimes. 25% say it's to stop the incident or prevent escalation. 21% to improve police surveillance or believe they have that responsibility to report. But a lot of the people who don't report do it because they're afraid. 20% say it's because they feared some sort of retaliation for reporting. A lot of people believe that the police aren't going to do anything to help you, and the police aren't necessarily required to help you. Like the 2005 Supreme Court decision said that the police aren't obligated to protect you unless you're in their custody. And things like that make a difference to what people come forward to report crime. You're more likely to see the people reporting the crimes are the people with so little more power, whether that is a white woman with money versus maybe a poor Black trans woman, that they are less likely to come forward and ask for help and try to get the crime punished by the courts or the law. So I wanted to talk a little bit about the effect of sexual assault culture on men, because unfortunately, when we talk about sexual assault culture, we'll exclude men from the conversation because they're framed as the main perpetrators. And yes, most perpetrators are men, but this culture also takes like a sense of autonomy away from men. The whole boys will be boys thing really does take a sense of autonomy away from a boy sometimes, that they have power over their bodies and they should, really blame their lack of sexual control on the girl wearing a tank top and showing off her shoulders. This is really belittling to the power that boys and men have over their bodies. They can control themselves. They should be taught that they can. But then you see this other problem too of internalized shame, whether that's, over offenses they might have done. Maybe they did have a consent violation when they were a child, and they didn't really understand at the time. They feel really bad. They're trying to be accountable and an ally moving forward in their life. And we need to be able to talk to people and talk about accountability a little more while encouraging them to become better humans for everyone. And then also, men are victims of actual assaults as well, and they are less likely to report than women because oftentimes the sense of like threatened masculinity just because they were sexually assaulted, and that's not okay either. So I'm sure you guys have seen plenty of examples of assault culture normalized in our media. Some of the most influential stuff is from cartoons because, we're young and impressionable at the time when we see it. But things like 90s Disney, where you kiss the princess awake, she's never met you before. That's a little disturbing when you think about it. And like Beauty and the Beast, maybe way down the line after Beast grew up and was accountable, they might have had a healthy relationship. But it was not a romantic history in the beginning. Don't fool anyone. And of course, our more recent problems that we've talked about more on social media with Pepe Le Pew, a little more clear-cut example. But then you see like victimization, objectification, and those sort of things in advertisements and headlines as well. These are some like real ads. Some of them, all of them are pretty tasteless. And even the ads that may come across as more, kinky to us, like we don't necessarily think of it as, assault, because we have this ethos of negotiation and things before those activities take place. Not everyone has that sort of ethos. So like I didn't put some of the ones that are a little more like holding the woman down kind of thing, but that is still a problem in a lot of spaces because it's coming from a culture where you're not talking about consent beforehand. And so what are some of the possible solutions? This seems like such a big problem, right? Like it feels a little overwhelming, but we can do something to make the world a safer, healthier place for everyone. And when you look at any public health issue, you break it down into primary prevention, secondary prevention, and tertiary prevention. Primary is we are going to prevent the bad thing from happening, whether it is sexual assault or an infectious disease case. Secondary prevention is more, we are going to deal with the problem effectively and proactively when it happens. So early intervention when a disease happens, early intervention with rape victims and survivors, helping them get hospital care, helping them get rape kits done, helping them go to the cops. That's secondary prevention. And encouraging better practices at that level is secondary prevention. Tertiary prevention is like long-term after the fact things. This is, concepts like transformative accountability for abusers, or the judicial system, even though it's not very effective a lot of the time, it still, falls under this category of tertiary prevention. And a lot of sexual assault stuff focuses on the secondary and tertiary prevention, right? It's, with the victim blaming stuff, they say that, if you, had like reported the crime earlier or something, then maybe you wouldn't have been as bad, and you're bad for not reporting the crime right as it happened, kind of bullshit. That is a problem, focusing on those later phases. We need to focus more on primary prevention, which includes these different aspects. You see here, there's policy advocacy. These are the things that encouraging programming at schools, whether that's like consent education, sex education, things like that. Community education and awareness is, actually doing those activities that the law legislates for. Advocacy with survivors, helping people realize that this is very common. This has happened to their mother or their sister or their brother or someone they are close to. Then therapy and holistic healing. And this isn't, this is before the crimes happen. So let's heal the people who were assaulted as children and internalize that anger and now are going to further hurt the world. Let's actually heal them. Let's actually talk to the people who have internalized anger problems and need to be able to process things better. Let's give them mental health services and emotional health services so that they can, not become assaulters in the future. And also working on, empowering less privileged, I guess, people that don't have as much power to say no sometimes. And sometimes people feel like they aren't allowed to say no because, it's their boss that's demanding this and they want to keep their job. And that goes to systems change. Systems change is making power structures that, you know, make sexual assault a little more commonplace, harder to brush things under the rug. So that's like, you know, encouraging more women in upper positions so that, you know, the abusers might be more accountable when they do assault someone else, or, you know, making it a little more friendly to respond to an accusation. And, you know, this doesn't mean going 180 from victim blaming to witch hunts and burn down the perpetrator. You know, I like the concept of transformative accountability. And, you know, but we can't force victims to engage in that process. That has to be a systems thing. Accountability has to be something that's weaved into our churches, our schools, everywhere, because sexual assault happens everywhere. So these are the two resources I use the most for putting together today's class. They have some great stuff. Rain does a lot of running of resources for victims. More like they have the Hope line and a live chat where they can, you know, talk to you if you want to talk about your sexual assault, or if you need to find resources to get some healing. And they also have some great educational resources and explanation of the statistics that are out there. The National Sexual Violence Resource Center, they've been doing some really cool stuff with online programming against sexual assault for the month of April, since April is Sexual Assault Awareness Month. They're more about like education. They're more about putting on educational events and providing resources for community programming, for example. They have some really good stuff. One place that I really like that I am going to be trying to push to get some different consent advocacy trainings done in the Texas communities is through Consent Academy. They are based in Seattle, but they do consent trainings and consent advocacy trainings across the nation and internationally. They do it for, you know, first year seminars at college. They do it for businesses. They do it for the BDSM kink community. They do it for the dance community. They do work all over the place, and they have some really great materials, and they have a book called The Consent Primer, which is pretty good too. So as we wrap up, I just want like to leave you guys with the sense that we can do better. It's not impossible. People often feel like this is just something we have to accept about our society, that this happens, and we don't have to accept it. We can do better. We can educate on what is consent and empower everyone. This means empowering men, women, the neither or category. Like it is about allowing people to feel empowered about talking about what they want and don't want when something happens, and feeling like they can be honest about how things affect them. We need to teach responsibility for actions. We need to make transformative accountability a more popular concept, especially in settings that are essential for the well-being of humanity, like churches and schools. You know, that I didn't necessarily focus on in this class, but there are plenty of children who offend other children. You know, they assault other children, and we need to be able to incorporate these children back into the world, because they're not any more likely to commit a sexual crime in their adulthood than an average adult, actually, you know, if they're given proper treatment. So we need to, and we also need to support the victims and survivors. We need to stop victim blaming. We need to start accepting people's truths without necessarily attacking their truth. So, if you are a leader of a group and you are receiving complaints about assault or just consent violations in general, believe your victims. But also, if you want to investigate, you can, but that's not the same as default believing that every claim of sexual assault is problematic from the victim side. Like, they're the problem. We need to move past that. So thank you guys. I really appreciate you coming today to learn a little bit more about sexual assault for the Sexual Assault Awareness Month of April. So I am going to just go to this chat and see if I missed any questions that came up. Let's see. Yes, Consent Academy has been providing classes during the pandemic. They are still doing it virtually. They will offer intensives to various organizations, but they're also doing like public classes through their website. And I've been doing some of those as well, and they're really good classes. If you have questions, you can put them in the chat, or you can speak up if you want. If I don't get a question in a couple seconds, I'm going to ask you guys a question though. So my question then for you guys is, I'm curious. I mentioned some of the problems that we see in media where, whether it was Disney and you kissed the sleeping princess awake without knowing her, or, imprisoning someone you love, all the way to the advertisements that, victimize people. I'm curious what you've seen. I'm curious what assault culture and media things have affected you. One of my big ones growing up was Pepe Le Pew, because I just did not understand why people were laughing. Like, I didn't necessarily have an understanding of how wrong what was happening, but I didn't think it was funny. That was a big one for me. Anyone else?
Sometimes I recall growing up watching shows like the superheroes are strong superhero types, and commonly the man was not able to they were not strong unless they were able to work through their problems themselves. They were kind of left to a lonely place. Some were not quite as such, but I do recall some growing up.
Right. Well, and that goes back to the whole problem where people think that men shouldn't talk about their struggles with this kind of stuff, and they need to. We need to encourage that. Up, James?
Yes.
Did you have a question or a mention? Maybe not. Okay. If there's no one else, then I can wrap up today. So I got a question. Yes, mentioning TV and movie cop medical shows. Yeah, this whole thing that they portray the whole rape process after it happens, like how the victims interact with the police, how the victims interact with the hospital. You don't always have to have those exams in hospitals. And it makes the process even scarier than it necessarily needs to be. And that is not okay either. Someone else said that not a media thing, but yeah, culture, the whole, grab them by the pussy thing, that was popularized, unfortunately, is just not okay to encourage people to grab sexual organs without consent. The whole grab them by the pussy, well, how would, we assume that it's usually a man saying this, like how would the man feel if all of a sudden, someone just grabbed their junk and went to town twisting them? Like, that wouldn't be okay. That would be assault, right? So what's the difference? But people think there is a difference. A lot of people think women's bodies belong to men or belong to society in general. Or even worse, people believe, women's sexuality belongs to them or to society in general. Is there someone else? Go ahead.
I was just going to say, I was part of, I'm in a very big metropolitan area, the Baltimore, DC metro area. So there's tons of hospitals, and even spoke to a sexual assault unit. But not all hospitals are created equal.
Yeah.
And to unfortunately preemptively do the work to find out which hospitals have that coverage. So you may go to a hospital that has a unit and a nurse that's there 24/7, somebody that's always there. But there are some that just don't have the staffing. They're extremely understaffed and undertrained.
Yeah.
And you have to get specified training to become a safe nurse or a safe examiner. And you could potentially be waiting at a hospital for this specific person to come and do the exam for a few hours because they travel between hospitals. So at least here in my area, I heard of an experience where someone was waiting in the ER for about 2 hours, spoke to the person who was supposed to come and were ultimately, are you really sure you want to do this? Because you're going to have to wait about another 2 to 3 hours for me to get there. So it is in your best interest for yourself and for your community to do the due diligence to call your local hospitals to see what resources are there and which hospitals are better and which hospitals are crap. Just my 2 cents from having talked to detectives and from a hospital unit. They're not all created equal.
Absolutely. And RAINN, RAINN, I've used them before when I've been in an area I didn't know and I needed to figure out how to help someone find a provider, a medical provider. And yeah, like you said, like there is such an understaffing and shortage of forensic nurses and forensic examiners. And if any of you guys want to put your money where your mouth is, put money towards testing DNA kits, pushing your legislators to test DNA kits, and putting money towards forensic examiner training programs, because that is one of the serious shortcomings we have in this country.
And there was also a big legislation. Make sure that your legislators are not allowing your police departments to destroy evidence in bulk.
Yes, I
Because
heard about that one.
that just happened here in my area.
Yes, unfortunately, that a lot of people, feel like the statute of limitations stuff should apply for a lot of these things. And, even if statute of limitations has come up, you still want to know, because like we said, these people commit multiple crimes over their life. And you can still make a connection. Thank you. Yeah, and someone else was saying how I hate how men are told that we can't feel things because we're all assaulters. Yeah, that was part of the thing I mentioned, that we need to allow people to hold each other accountable and ask questions and feel problematic feelings and ask someone to help them be responsible. There are supposed to, be those sarcastic, silly memes going around. It's like, if you feel like you're going to assault someone, have someone walk with you. And just as like a contradiction to the whole victim blaming thing, but why can't we encourage some people to ask their buddy to watch their behavior if they have problems? When they have a couple of drinks, they don't necessarily respect that kind of thing, like your buddy to help you own up to your shit kind of thing. Alrighty, well, I am going to stop the recording and I'm going to post this on the FetLife event page for it, so you can watch the recording at a later date or share it with your friends. But thank you everyone for coming today. I really appreciate it, and I will hopefully be helping put out some other events throughout the month to raise awareness on these issues. Thank you.